So here we have a diagram summarising the features of SLE. As with all these diagrams, by removing the labels, the image becomes more memorable, and I would encourage you to use this unlabeled image to help you to learn and recall the information. Okay, so this is going to be a very quick run through on SLE, and I'm going to hope to cover all the key features in just a few minutes. What is the condition? It's an autoimmune condition which most commonly affects middle-aged women, and it's more common actually in Afro-Caribbeans. Okay, so what I'm going to do again is remove the labels, and I think the best way to think of this image is from the left to the right. So if we start on the left-hand side, you can see patients can have all sorts of different symptoms, but we'll start with the temperature, problems affecting the CNS, so headaches, polyneuropathy, stroke, and psychosis can occur. Depression is rare, epilepsy can occur, although it's rare. And then Sjögren's syndrome. This is where the lacrimal gland and also the parotid gland and salivary glands can be affected and lead to the classic dry eyes and dry mouth. Oral ulceration can occur. The thyroid can be underactive. There can be a generalized lymphadenopathy. In terms of red blood cells, patients can be anemic due to hemolysis. Patients can have hypertension, they can have joint pains, arthropathy. The peripheries can be affected with spontaneous vasospasm and the condition of Raynaud's. We've already mentioned peripheral or polyneuropathy affecting the peripheries. The blood count in terms of platelets can be low, so thrombocytopenia can occur, and this can lead to purpura or bruising of the skin. And then a urine dipstick may well reveal hematuria or proteinuria. Then if we consider the organs that can be affected in turn, this is on the right hand side of this diagram. The skin can be affected, that's common. The malar rash is classic for SLE, but non-specific erythema can occur too, or photosensitivity. The lungs can be affected, again quite common, 50%. With various inflammatory conditions including pneumonitis, pulmonary fibrosis, the classic honeycomb lung, and pleurisy plus minus effusion, areas of consolidation, etc. The heart can be affected, less common, but about 40%, with pericarditis, again inflammation. Splenomegaly can occur, and the renal system can be affected, and this is very common, 100%, almost always involved. The conditions that can occur include hypertension as a consequence of renal disease, and nephrotic syndrome. We mentioned arthropathy already, but again the joints as a general rule can be affected in 90% of cases with a migratory asymmetrical polyarthropathy occurring. And that's it, so a nice, hopefully helpful, quick summary of SLE.